I guess knowing that ultimately I did want to try to go the Fed route, it was important for me to find a position, even if it was a contractor position, but that you sit in a federal space, that you weren't in your own like Aveshka building. Like Aveshka has folks who sit across HHS, whether it's CDC, ASPR, where I'm at, but you're sitting there and you're working on a federal team. So you're part of the team, you just have a different employer. So it was important for me to find a job where that was the case, where you're more embedded into the daily activities of the team. So that, in the event federal positions come out, the boss is already familiar with you, you're applying for jobs, you're letting them know you're interested, and just kind of being able to network like inside in, instead of applying just on, USA jobs and your application doesn't go anywhere. So that was kind of like the plan in the background, but also just kind of, being able to touch into a new space in public health, and that being challenging for me because I hadn't, done that across my career before.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 86. Hi everyone, Omari Richards here. Thank you all so much for joining me. First and foremost, be sure to follow me on Instagram at DrPH Millennial, and you can subscribe to my email list as well. I don't know the pretty link for that, but be sure to subscribe to this podcast or follow it if you're on Apple Podcasts. Leave a review if you have not as yet. It greatly helps the show, shows people it's valuable, helps more people know about the show so they can navigate their public health career. If you'd like to support, you can go to buymeacoffee.com/the Millennial, or you can go to the phmillennial.com/support and find out the different ways to support there. I really enjoy this episode. I think there's some great insights in here. Some of you probably already know this person or at least follow her on Instagram, but I really liked her idea of having a timeline for jobs, especially for jobs where you're like overqualified or you're just using it as a stepping stone for the next job, so that you're not like making yourself stuck in a situation, but you're just continuing to use that timeline to push yourself to learn what you need to learn to get to the next position. But I'll let her talk more about that, and I hope you all enjoyed today's episode. Today we have an experienced researcher with a unique background in public health and social work. She got her Bachelors of Science in Family, Youth, and Community Science at the University of Florida. Go Gators. She then worked as a family care counselor for 4 years before starting and completing her Master's of Public Health at the University of Florida. Go Gators again. She currently works as an Interdisciplinary Scientist at the U.S. Department of Health and Human Services. Additionally, she runs a focused health collective where they are re-examining our understanding and engagement with public health, our individual health, and the health of our communities. Check her out on Instagram at Focused Health Collective. We have Rose Marcelin, MPH. Welcome to the show.
Hi, thank you so much for having me. Happy to be here.
Yeah, I'm glad to connect. I know that we've connected on Instagram like a while now, so it's good to actually connect, and I'm happy to be able to tell your story in our public health today.
And I'm excited, and you're Gators, so there's the Gator thing going on here, so excited about that.
Absolutely. So how have you been doing, and how have you been coping during the pandemic?
It's touch and go. I think in terms of COVID and COVID work that I do, I'm just tired. It's been almost 2 years of work related to COVID, and I'm ready to move on to the next topic, but unfortunately, COVID is still here. So that's the work side. Personally, I've gotten used to just doing things more to myself, staying, low key, but I'm kind of ready. Trying to get this booster so I can feel more confident, more comfortable going out, but just making it day by day, seeing how things go for the most part.
Okay, well, that's good. And yeah, I could only imagine if you've been working in COVID-19 and it's just continuing this, and it's like playing on every part of your life, so it could definitely be a lot. So we understand that. How do you identify, and then tell us a little bit about your personal background?
Of course. So I identify as Haitian American. I was born in Haiti, raised in Florida. And I really consider myself to be a public health professional at this point, but really someone who likes to really understand why people do what we do and making sure we know how to best reach different groups of people. I think my career in public health has kind of touched a lot of different, areas, and I'm sure we'll go into that. But I really want people to understand how public health impacts our lives daily. And so I try to do that at my professional job and then in my business as well.
Okay. Yeah. And I think that that's important. And it kind of plays into the next question that I'm going to ask. What does public health mean to you?
Oh man, public health, I think we have like our standard definition from like WHO and things like that. But I tell people public health, we interact with it every day. It's in the foods that we eat, how we, travel, transportation, our daily lives. It impacts us in so many ways, not so much just, preventing, disease, but also how we live and interact with our environment. So I try to look at public health in a holistic way to consider, your spiritual health, your mental health, going just beyond just the physical health or the absence of disease or however it is that WHO says it. So it's really all encompassing when I think about public health for me.
Absolutely. And yeah, that's definitely the answer we get, or what we hear a lot of, just it being in everything, or like touching everything, or interrelated in some way to everything that we're doing. And I think that is hugely important. Where in Florida did you grow up, and what age did
I grew
you
up in
move to Florida?
Miami.
And what age did you
Yeah,
move
I
to
was
Florida?
like 8, I think. I was in the 3rd grade. I knew I came here and I was in the 3rd grade. So I was in Miami, went to high, elementary, middle school, high school, and then moved to Gainesville for college, and then lived there for a really long time. And then went to grad school there. But most of my family, everybody's back in South Florida.
Okay, so flow life. Got you. All right. So you got your Bachelors of Science in Family, Youth, and Community Science at the University of Florida. What was your thought process going and getting a degree in general? And did you start off as a Family, Youth, and Community Science?
No, I did not start off with that degree. I think when I went in, I was like psychology, I think, on a pre-med track, the typical like Caribbean, you're gonna be a doctor. And then the first semester, it was like, no, I got to drop this pre-med situation. It was not working out with the biology and stuff like that. And then I think the end of my sophomore year, psychology just was not really doing it for me either. I was not interested in the topic. And then the FYCS degree was still pretty new at UF at the time, but it was starting to get some traction. And I looked at the curriculum, talked to a couple of professors, and I was like, oh, okay, this sounds more like social work. Essentially, it's a social work degree without the name social work. And I thought at the time that's what I wanted to do. So it's kind of like a perfect fit. So I didn't switch my major until my junior year to that, and then had to hurry up and graduate.
Okay, and to that point, why or what made you interested in social work, or how did you hear about social work just generally?
Yeah, I think just generally, I've always wanted to go into a career with helping people, which is probably why I wanted to do the medicine route, save the world type of, goals. But I understood that, medicine wasn't for me, that wasn't it, but I still wanted to contribute to society and to help people and work with kids, work with families. And so when I did the social work or FYCS program, we learned how to understand like communities and the way that we interact with each other, different theories and models that really show that there's actually a science in how you work with people in different populations and things like that. So it was just right up my alley at the time. Not anymore.
Not anymore. Okay, and we'll dive into that. Not anymore, I'm guessing, along your journey for sure. Yeah. So were there any other takeaways or experiences that I think it's because I didn't see any experiences that you had like during your undergrad that maybe you wanted to talk on. If there are none, I could just ask you what are like some big takeaways that you had from your undergrad experience.
Yeah, I just feel like it was so long ago, but I think what I remember, and I still to this day stay in contact with a handful of FYCS professors just because the program was so new. And that was probably the best thing I could have done, was just to, check in every once in a while, just say, hey, how are you guys doing? How's the program? How it's growing? It started with just, I think, like 10 students at one point, and now it's really gotten bigger at UF. So it's been pretty cool to stay in touch with those professors because they came around and provided reference letters for grad school. So I say like that connection is important if you still want to, study.
Okay, yeah, that makes a lot of sense. Okay, so after you graduated, you went into family care counseling at Family Preservation Services. So tell me about that thought process from going from doing your degree, graduating, and looking for a job, and how did you come across this job and all of that?
Yeah, when I graduated, it was just like, I need to find a job. That was the number one goal. And at the time, I was still in Gainesville. So I was applying to jobs all over Florida for the most part, but I got hired as a family care counselor, which is like a social worker, case manager type of position at FPS. So family preservation at the time was this community-based organization that handles the kids who were placed in foster care in the Alachua County and the surrounding counties. And so I didn't know what the job really meant. I just knew it was a job. I started literally 2 weeks to the day after graduation. I was like, I need to get paid. This whole broke college life I was over it. But that's how, just, interviewing, the whole traditional thing. But I was fortunate enough to get a job pretty quickly out of college.
Okay. And how long were you in this position for?
So I started in 2007. I left in 2013 when I finished my MPH program. So I think I was about 4 years in or so when I started grad school, but I was working full-time and doing the MPH program full-time at the same time. And then, once, we had to leave if you didn't have to leave, once you had to do the internship for grad school, that's when I quit the social work job. But the good thing was the social work job was flexible enough with our schedules so that I was able to attend classes on campus and still maintain like my caseload with the kids and stuff like that.
Okay. So can you talk a little bit more about what you did as a family care counselor, kind of more big roles and responsibilities?
Yeah, sorry, I probably skipped over that. So essentially, we would come in as the case manager once a child was removed from their parents. So, the state comes in, there's some allegation of abuse that's kind of been warranted, and the child is placed either in foster care or, with a relative or a family friend. And so my job oftentimes was to try to reunite the child with, mom and dad. And so that meant working with the parents, whether they needed to get enrolled in counseling, drug treatment, just working with them to either improve their parenting skills or eliminate the risk where we felt confident enough to put the child back at home. And if that wasn't the case, then we worked to either try to find a long-term or a permanent placement for the child, whether it's adoption or, staying with an aunt and uncle. But it was really a lot of all day, every day, you name it, it happened type of job. I always say this job set the tone for like how I handle difficulties at work. When they ask you at interviews, like, tell me about a job where you were stressed out. This was the job. It was a constant, you were on call all the time. You're traveling up and down the state, trying to find a home for a kid. And I was like 21, 22 at the time, responsible for, 30 kids at a time. Some of them were teenagers, almost my age, but here I am trying to tell them what to do. So it was one of the most stressful, but yet rewarding experiences of my life. At the time, it was, I would say I've never been that stressed in all of my jobs to this day. So at work now, when they're like, oh, is this too much for you to handle? I'm like, this is nothing. Give it to me, I'll knock it out. But that job, yeah, was a lot.
Okay, and that sounds like it was a secret blessing that it gave you more resilience in doing the work, as well as, I think, as a key point you made in noting that this job might be hard or taxing in this way, and knowing how to talk about that in the interview, and like leveraging the difficulties that you had, or the challenges and struggles, and sharing that to really elevate yourself and share that, okay, yeah, I can work in high pressure situations or this or that. And I think you highlighted that a lot. And then a little earlier, you said that you got your master's in public health at the University of Florida, and you said you started that while you were working in this job. But when did you hear about public health, first of all?
Yeah, good question. I don't know when exactly. I think for me, it was knowing that at first I thought about going back to school and doing a master in social work degree. And after 2 years, I was like, yeah, no, that's not my life. I can't do it. So I was just, browsing for different, master's programs, seeing what was out there. But I think a key moment for me was, so as part of the job, we had to, make sure all the kids that we managed essentially had their dental appointments every year, their medical appointments, and their vision appointments every year. So at first I was kind of like, oh yeah, like you would think every kid would get that, but that wasn't happening. So I know like we really had to crack down on making sure like the kids had their medicals in place. But what I started noticing, and you lived in Gainesville for a while. So in Gainesville, it's, there's the side with the university, the side without the university. And clearly I started like right away noticing health disparities and just like access to care. I'm like, oh, okay, this kid has, private insurance, we could get him in for an appointment really quickly. But most of our kids had Medicaid, and there will be months and months and months long wait lists to get a kid in to see a dentist. Or we had a foster parent who lived, in a more rural area, and she would have to drive, an hour and a half to Gainesville just for an appointment, and then drive an hour and a half because there's no providers, out where they were. So I kind of was like, this is weird. Like, why is this like a thing? Like, I guess for me growing up, it was like, oh, my mom took me to the doctor, not really thinking that some people it might not be so easy for others. So some way, somehow I stumbled on the MPH program and really understanding public health disparities, issues around access, understanding Medicare, Medicaid, providers and stuff like that. So that kind of was some of the impetus for me to apply and really see how I can kind of combine some of the social work stuff that I was doing to the MPH program. And I ended up doing the social and behavioral science track, which I think lined up with some of the social work stuff that I was doing too.
Okay, and I think that makes a lot of sense. And I think that it is a similar like theme in stories that you hear people say, is that if they hadn't heard about public health, they were doing work trying to help people, and then there were these other like systemic issues that you see realize and reappear, and you're like, oh, how do we get to like that root cause? Because I'm trying to do this thing, but that thing is like stopping them from actually thriving at what I'm trying to do here, and we need to make sure that they have those fundamental things. And I think that that's the case for many people coming into public health. If they haven't heard about it and they're in the workforce, they're doing something very adjacent to it. So yeah, I think that makes a lot of sense. Did you apply to more than UF's MPH program?
So I applied to UF and USF, University of South Florida's program. I got into USF, but they sent the acceptance letter way too late, and UF was kind of like, okay, you're coming. So I went with the home team. Go Gators.
Okay, go Gators, go Gators. That's funny, because when I applied for my Master's of Medical Sciences programs, which I'm glad I didn't choose to go down that route, but USF sent me my acceptance letter late as well, and pushed my acceptance to the term after that I applied, and didn't even tell me anything. So yeah, and interesting.
Yeah, I found out, I think like the week I was starting the program at UF, and I'm like, what? Yeah,
that's literally what happened. Like, it was between me do my MPH at UF or do my Masters of Medical Sciences at USF, and I decided to do MPH at UF. So
Yeah.
very interesting. And the USF, you got to work on that if anyone's listening.
No, yeah, it's like maybe it's a thing they got going on.
Yeah. All right. So during your time, why did you choose to do the SPS concentration actually?
Oh man, the other ones just weren't that interesting to me. Epi, I was like, I don't understand. It sounds like math. Stats, for sure, was not doing that track. And then I think I went back and forth between the policy track and the SBS track, but I think I just, with the work that I was doing, the SBS just made more sense for me. I think I had practical experience out in the field. And to me, it just kind of lined up, and I think it worked out for me in the long run because I worked in communities, worked with people and understanding, access issues and things like that. But I didn't have the theoretical background. And I think that's where the SBS kind of came in to understand like why these things, were happening. So it just was kind of like process of elimination. Didn't really like the other ones.
Yeah, absolutely fair enough. And I think like with outside of like biostats and epi, it's very transferable, a lot of the skills that you get from the other concentrations in public health generally. But yeah, the SBS focusing especially on the theory and understanding how that impacts like social behavioral health, as the concentration is called, is important. And that's why I think it's still like the biggest concentration at UF.
Oh, is it still? Okay, that makes sense.
When I was there, it was my concentration was like really tiny, and they were like a lot bigger, like magnitudes.
Okay. Yeah, I think we had like 30 something in SBS and then like 5 in the other ones or something.
Yeah. I think that ratio is pretty similar to this thing. Okay. So during your time at UF, you were a supplemental instructor at UF. So what is a supplemental instructor, first of all, and how do you get into that position role?
Yeah. So mind you, I was still working my social work job full time, doing grad school full time. But because I was working full time, with the tuition, UF was kind of like, oh, you can afford to pay. And I was like, no, I can't. So I was like, I need to find a fellowship. I need to find an assistantship or something. But I happened to have a friend who was a second year. In my first year, she was an instructor, a supplemental instructor. And she was like, hey, you should apply. They need new people for next year. So a supplemental instructor essentially is, how do I explain this? So you get a assistantship through I think it's the athletics department. So they fund 75% of your tuition, plus you get a stipend. But the job was you worked with student athletes who the NCAA, felt like they needed extra assistance. So it wasn't quite like the tutors that you hear about athletes having. I guess it was kind of like a tutor, but not those tutors. So I will go to a class with them. So I was working with students who were in the FYCS undergrad. So it worked out because I used to be an FYCS major. And so you would go to class with them, you'll sit in the back of the classroom, you kind of take notes, kind of monitor their attendance for those student athletes you were assigned to, take notes, and then I would reteach the information at night, twice a week. Oftentimes, with student athletes, they're traveling a lot during the semester, so sometimes they might miss a class. So twice a week at night, we will reteach the material, but it had to be in a way that was easier for them to understand. A lot of them had, some issues, with study skills, and things like that. So we had to be, really creative in how we retaught the information. And the goal was to have every student that you were assigned to, to pass. And so we will meet every week with someone in the athletic department who's in charge of like academics, and you will provide updates on students who were, struggling a little bit that was beyond maybe my expertise and who needed more help. So that was kind of a really cool experience to see that end of things, being at a big, athletic school, but really understanding how they really try to provide these services. But also it was great because they were paying my tuition and I was getting a check every 2 weeks. So that worked out.
Yeah, that's not a bad setup whatsoever. I'm surprised more
Yeah.
people aren't talking about that supplemental instructor you have, or like just in other schools as well. But that seems like an awesome opportunity, and like going back to like insights that people can take from this. You networked with the second year MPH student who told you about the opportunity, and then she told you, oh yeah, you should apply for this. And that is just as important as knowing about it, like knowing the people that know about
Oh yeah,
it.
for sure. 'Cause I would never have heard of this thing. But we would do like joint, social activities with the second years and us at first years, and just in conversation. And because she was also a second year student who was working full time as well. So we were a little bit older, quote unquote, than some of the undergraduate, the younger students. So we just kind of connected that way anyway. And then she told me about it. And it was just a very, I guess, like a small niche within the athletic department that they don't post online, they don't advertise for positions. And it was just kind of like through word of mouth. But once I saw all the tuition stuff, I was like, yeah, I need to get in there.
Yeah, absolutely. Sounds like a great decision as well. And then also during your time in your MPH program at UF, you were a public health intern at the U.S. Department of Health and Human Services. So tell me about how you get that, and then what you do.
Yeah, that one. So, we have to do the capstone project with your internship and stuff like that. And it was like the struggle trying to find an internship. But I've always wanted to move to Maryland or DC area. So this position was with HRSA, Health Resources and Services Administration. And so they were based out of Rockville. I just applied. Usually most federal positions have, not most, a lot of agencies under Health and Human Services have summer internship programs. Unfortunately, they're just unpaid, but it was still like a really cool opportunity for me to go to Maryland and work there while I was working on my project for grad school. So essentially at HRSA, I was on the team that works with children with special healthcare needs. And so there's federal programs that really supplement funding for medical providers to work with those kids. And so part of my job was to work with the grantees who are receiving federal dollars and just making sure they stayed, within the guidelines of what they said they were going to do in terms of access for kids with disabilities. And especially as they were turning into adults or turning 18, making sure there was like transitional planning. And so I was kind of like a project officer, just kind of reviewing their status updates, making sure, they were using the money appropriately and things like that. But it was really cool because I got a chance to see work being done at the federal level. Got to talk with a lot of folks who were DHHS officers, Public Health Service Corps, because I had never heard of that. So it was really a good eye opener into different possibilities within like federal public health.
Yeah, and I think like that's important to highlight, like taking on this opportunity, open up your eyes to other opportunities and things that are out there. Because I never heard of Public Health Service Corps until someone came on my podcast and was in the Public Health Service Corps, and they explained that. So I completely agree. And like to that point, once again, public health is just very varied and broad, and there's just so many different things that you can do in it. So there's always a lot of learning that you can do.
Yeah, it's amazing. I was talking to someone the other day while I was working on like some applications for grad school now, and I was like, wow, like I really feel like my career isn't a straight line. Like I've kind of touched on different things in public health because I have, just interest in different areas. The good thing about public health, there's a way to kind of squeeze it in there and make it work regardless of the topic for the most part. So agreed.
Yeah, absolutely. Okay, and then tell me about the thought process behind you. You said that you were working full time for the most of your MPH program, and then you stopped working full time, or you quit your job when you got your internship. Was that it?
Yeah, because since I was moving to Maryland, so had to, quit that job. And what was I? Yeah, I just lived off of savings. Oh God, that was a struggle. because obviously Maryland is a lot more expensive than Gainesville. But that's what I did. I worked full-time 9 to 5, and then at night we'll work on the final paper that you need to graduate in your presentation and stuff like that. So that's what I was doing then.
Okay. Okay, awesome. Well, thanks for sharing that. And were there any other takeaways that you had during your MPH program that you wanted to share with us?
I think with the MPH, definitely what I enjoyed was the networking with my classmates. Weren't calling it networking then, but being active, in the program. I was the social chair for, was it PHSA, Public Health Student Association. So just getting people together, which probably was the best thing I could have done, because I've stayed in touch with just so many of those people. And seeing how their careers have developed over the years has been, really great. So if I have a question or need to, run something through, I'll text someone like, hey, random, but do you remember when we took this class, or what are your thoughts on this? Or so just having those connections now to this day, especially since now I'm back in the DC area, I'm in touch with at least 4 women who were in that program who live here. So we get together, we're friends. So that's probably my takeaway. Just make sure you're staying social as much as you can, or your schedule allows you to stay in touch with those folks in your program.
Yeah, key insights. There's a lot of learning that can happen while you're in your MPH from other people in the program. And like, as you said, everyone's career progresses and you all continue to do different things, there's a lot of learning and networking and opportunities that come out from that continued connection. So yeah.
Oh yeah.
Okay, awesome. So then you graduated from your MPH program and you became a research supervisor at the University of Florida in the weight management project. So how do you come across that, and then what do you do?
I told you I had to go back, look at my CV real quick, right? But I just remember that. So I graduated in August of 2013. And you know how you think like, oh, I'm going to have all these jobs lined up? It was like crickets. And I was applying into the black hole, and just happened, luckily enough, it was a job on campus at the University of Florida through the dean's office. I knew somebody who worked there, and I was like, hey, I'm trying to get a job. And, she put me in touch with someone over there, and thankfully I got that job. But it was kind of, I tell a lot of public health students now, like sometimes you just got to take the job that is offered to you. Because again, at least for me, you need money, right? So I was like, I need a job, I need to get working. And it was a job that I just had to do because I needed something. Like when I came on board, they were like, oh no, you kind of overqualified. And I was like, it's okay, but I need a job, like I will do it. But I also knew for me, I had like a timeline, for this job. I was going to work there for a year, get experience, and then move on. But it was really managing, what did I do? Managing so graduate students, PhD students who were part of this program. So they would go into the communities, recruit participants into a weight loss program that UF was running. So, we would monitor them over the course of, I think, about 6 months to see if the intervention was kind of working, if they were losing weight, BMI was going down, things like that. So part of my job was just managing the students who did the project, making sure they showed up for their shifts. It was just like very basic work, but I could finesse the public health part of it. And it was, the experience that you need to get something else.
Yeah, and I'm glad that you highlighted that, because that is very important. And especially, I think the timeline part, I love how you said that, because you're going in and you know that you need this job to just have money, to pay bills, to have a lifestyle, to live and whatever. But you also know that this is like a stepping stone for you. It's not like a permanent thing that you're going to have. And I think it's good and healthy to set that boundary, knowing that you're overqualified for this job, but it's going to help you to solidify yourself and get you to that next step within that year, or like in that year timeline that you set for yourself, which is a good thing to do, and a good way for other people to think about it too. Because especially right after you graduate, it's not going to be, especially now, this is not going to be a lot.
And I tell students that all the time. I have students reach out to me, on LinkedIn and stuff like that. And I'm like, sometimes you just got to be humble. It's the job that offers you a position, you take it, with, of course, the intent to learn the job, right? And learn. So I got a chance to work with some really high level researchers at UF and understand like their protocols, how to write an IRB application and things like that. So I wanted to take and learn from the job, but I also knew we had a goal. Like after 12 months, I needed to be, working on something else.
Yep. And then, so the job that came after this was a research coordinator at the Institute for Child Health Policy at UF College of Medicine in the Department of Health Outcomes and Policy. So how do you come across this, and then what do you do in it?
Yeah, this was like a networking thing. I had a friend from grad school who was working over there. ICHIP is what we called it. And I was like, hey, looking for a job. I think I was at the 6-month mark at the job at the time. And she was like, oh yeah, we're hiring for different research coordinators. So at UF, there's the coordinator 1, 2, 3, levels. And so she was like, we're constantly hiring for, research coordinators at the first level to come in. So, applied, thankfully got the job. But it was really cool because my career was still young at the time, and I got to do public health evaluation work, which is something I hadn't done before. But I think what helped me get the job was the internship I had working with the kids with special healthcare needs, because that's what this position was focused on, working with medical providers in the state who worked with children with special healthcare needs. So there was that connection too, which I think helped me get the job.
Yeah, absolutely. You never know when those prior experiences are going to come in and be beneficial for you. But yeah, thank you for sharing. As well as like the networking opportunity of like, knowing the people there and getting in that way as well, which is usually helpful. So before, like, were you able to get out of the previous job within that 12 months or like near to that 12-month mark?
Yeah, it was like month 7. Month 7, I was out of there. But what was good about it is obviously I didn't go in the job telling them like I'm leaving, but I let them know without letting them know like, this is, guys, this is not a career for me. Like, and they were cool about it. Like they were fine. And actually the supervisor at the time, wrote a recommendation letter for me to get the next job. So they were very supportive as a unit. So that worked out too.
Okay. Well, that is great to hear. And then after the research coordinator at I can't remember what you call it, the Institute for Child Health, ICHIP. You were a ASPPH Public Health Fellow at the CDC in the Division of Population Health. I don't know if you know what ASPPH is off the top of your head.
Yeah, Association of Schools and Programs of Public Health.
Okay.
So they work, I don't know. Yeah. They work with a lot of public health programs.
I've seen the acronym around like everywhere. I want to say they sponsor a bunch of stuff as well. But I'll put a link to the ASPPH and you all can do some research and let us know what they do exactly. But okay, so how do you come across this opportunity, and then what do you do in it?
Yeah, so I think as I'm talking to you, I realize like I've kind of had a theme in my career, which is like I give myself a timeline at jobs. So with the coordinator position, I gave myself 2 years, especially like at the coordinator 1 before moving to coordinator 2 or moving somewhere else. So with the fellowship, so ASPPH, I don't remember like their big thing, but they offer a lot of fellowships that are paid. So it's kind of like an ORISE fellowship. I don't know if you're familiar with ORISE, but it's kind of like the same idea. You get placed somewhere, you apply, you interview, and then you interview with the specific team. So for my team, it was at the CDC, National Center for Chronic Disease Prevention, blah, blah, blah. But essentially you get assigned a mentor on the team that's kind of who is your supervisor, but you are working at the agency, you're learning, and then you kind of work on like side projects for ASPPH as part of your, contract. So you're not a CDC employee, you just kind of assigned there. But it was a really great opportunity to, of course, you know, be at CDC. At the time, I was like, oh my God, like my public health dreams are coming true. And then you realize it's like another job, you know, but it was also, you know, a paid opportunity. It was a place to work with really great scientists and researchers, and do, so I was doing evaluation work there.
Yeah, and did you have to relocate for this position?
Yeah, I moved to Atlanta for that job, which was a big deal for me at the time, coming from Gainesville, because I'd lived there for almost 10 years at the time. So moving to Atlanta was like, okay, big city, you know, moves and stuff. But it was a good time. I had a good time in this role.
I'm glad that you did. Was the fellowship for a certain amount of time, 12 months, 24 months, or anything like that? Or not so
I think
much?
the one I did was 24 months, and it's renewable up to 5 years, you know, if your program had the funds to support. I think they had like a co-agreement with ASPPH, like they paid for half and then ASPPH paid for half of your salary. And it was also contingent on, you know, whether they had space for you or needed you. And then I think you could switch to a different team if you know, needed to or wanted to. And it was like a cohort. So there were other fellows who came in at the same time as I did, and you know, would have like occasional meetings with them and just kind of touch points, you know, to see how the fellowship was going, what you were learning. And there were, I think, like different tracks, I want to say. So I remember there were a couple of folks who were doing like sexual health, and so they were over at the like STD center at CDC, but I was doing evaluation, so it was just me over there. But it was a group of us, and it was renewable up to 5 years.
Okay, and I feel like you didn't touch on, did you have a lot of evaluation skills up to this point, or was that more of learning about evaluation while you were doing it?
It was a little bit of both. So at iChip, towards my second year there, we transitioned to do more evaluation work. So the program it was a pilot project that the state was putting on Florida with these medical providers to see if they can become a medical home. So a medical home would be a one-stop shop service for a child with a special healthcare issue. So instead of them having to go to, you know, 6 different locations to see 6 different providers, the medical home, you know, ran, you know, all of the care for the child, worked with the school, worked with, you know, whatever services they needed. And so the second year, at least when I came on, was the beginning of an evaluation period to see, you know, what worked, what didn't work. And so I think that helped, just being able to understand like program evaluation, like, you know, indicators, performance measures, things like that. So I was able to throw those buzzwords in there when I was applying for the fellowship, because I ended up doing sitting on an evaluation team at CDC, and clearly that's what they do all day, every day. So.
Yeah, and I think that is another insight that's really great. When you're going into like these specific type of roles or like parts of the field, you have to know the language that they speak. So knowing those key metrics and performance and I don't know why I know
indicators, like, yeah, I was like,
yeah.
I'm just gonna throw these words in here and see what happens. But it worked out. But then you also got to see that evaluation isn't as technical. Well, it is a very technical skill, but you also see like how important it is to the work that we do. You know, we put out programs, but are they sustainable? Are we actually working to measure impact? You know, what are we really doing besides doing a project for the sake of doing a project? So it was really good to kind of see it from that perspective, because their focus was really making sure that whatever we funded really started with evaluation first, making sure like the grantees knew that this was something that they had to do. So that was kind of cool to see.
Yeah, and I think that makes sense. Like evaluation, like once you have like the baseline understanding for it, it's pretty simple. It's just like to the point of asking the right questions. What are the things that we're actually going to evaluate that are going to tell us that we're doing a good job, or tell us that we need to change this or adjust that to be more effective? And I think that is a thing that takes like more skill to learn and know, like what are those things that are going to be more impactful in the long run. Yeah. Okay. And did you say how long you stayed here? I don't think I asked that. Did you?
I stayed there 2 years. That's my usual cutoff for a lot of things. I was there literally 2 years. I didn't do a third year. That position, while it was great, towards the end really became a very toxic environment. And I knew for my own mental health, I couldn't stay. So I quit, actually. I didn't. I was like, no.
Okay. And toxic in what way, if you'd like to share?
Yeah, so I don't mind sharing. I think maybe this happens to younger, professionals. I think sometimes, so I was working on a team with mostly older colleagues. And so my manager, I think just had the idea that as a younger person, you're not working as hard, or because I would say, why do we need to, something mundane, like why do I need to print a 40-page report when I can PDF it and read it on my computer? But for her, if I didn't print it, it meant like, oh, I wasn't reading this document. I'm like, no, it's on my screen. So there was just like that petty issues, but it just became, it just took a turn that I was like, it wasn't healthy. At the time at CDC, funny enough, there was a big emphasis on anti-bullying behavior. That was a big push under Dr. Frieden when he was there. And funny story, so we had a suggestion box for the team, right? Like you can put a suggestion box or a suggestion in a box to help the team get better. So anyway, somebody put a suggestion in there that says, our boss, this lady, is a bully and needs to go to bullying training, anti-bullying training. Somehow she thought it was me. I don't know. I'm like, I wasn't even here. I was at a conference when this whole thing happened. I come back and they're like, she's asking everyone if it was me, But anyway, that became like a very toxic situation. I'm like, well, you are proving the suggestion box correct. You were always, finding something, here. But all that to say, it wasn't a good fit. And I knew I just couldn't work under her for a third term. So I was like, you know what? I don't need this job. I'm okay.
Fair enough.
Not worth it.
Yeah. Your health and well-being is definitely more important, especially if she's coming at you like that. I think that is very unreasonable. Yeah.
Yeah. Some, the advice at the time I got was like, you just tough it out. You can do another year. You can, meet different folks, because what you wanted was for that fellowship to turn into a full-time position, like a permanent position. So, folks, I would ask advice, would say, just do another year. Like, you never know what's going to come out of this third year. You can do it. And I was just like, I don't want to FTE that bad. It's okay.
Yeah. Fair enough. So you quit that job and then you got another job as a senior health communications research specialist at ICF Next. So how did you come across that, and what did you do in it?
Yeah, that was just the application. So when I quit in January, I didn't start that position until like 5 months later. So it was just, the daily grind of applying to jobs and doing that over and over every day. And then I realized quickly that, one thing I learned from that old position was I really wanted to be intentional about where I was going next. At first, I'm just like, I need a job. I'm applying to everything under the sun. And then I'm like, if you did get this job, would you even want to do this? Do you even care about this topic? Do you even see yourself doing, this kind of research? And for me at the time, I didn't want to do evaluation work anymore. I really didn't want to do that traditional public health research anymore, and really move more into like implementation and actually doing things besides research. So I started focusing more on looking for jobs that, allowed me to use my research skills, but yet do something, more contemporary with it. I was doing a lot of like academic research. I was doing some publications, and I was just like, I don't really want to do that anymore. So part of that, 5-month process was just really being intentional with the jobs I was applying for. So when I got the position with ICF, it was in Washington, DC. And funny enough, ICF has an office in Atlanta, and I had applied to a bunch of jobs there, just doing like research, management, that kind of stuff. But this position, really interested me because we didn't have a lot of health communication classes in grad school. I've always kind of been interested in that communication piece. So it worked out that they hired me for that one. That was awesome. A ramble.
No, not at all. And I wanted to ask, like, so you said that you wanted to shift away from like evaluation or like doing more theoretical things to actually like kind of doing the work implementation, which is probably a place that a lot of people are, or like where they're trying to get to. What were the things that you like maybe brought to the interview or brought to your, I don't know, your outlook that you think helped you to make that shift and get this type of position?
That's a good question. I think one of the things I know I focused on was really talking about the outcomes of the work that I was doing, that I did do. So with CDC, it was a few publications at the time that came out, but it was just showing that, I was able to move the work from just like, okay, a research project into something that was published, in a journal, and showing like results that way, as opposed to just, talking about being able to, write a project plan. Like that's great, but like what came out of it? And I know I try to focus more on productivity when I was interviewing. And I think that's where I really try to master the whole like understanding like transferable skills. Like what I was doing, at CDC may not be exactly what ICF was doing, but there were still like core skills in terms of like project management that I was still able to bring with me. It didn't look the same, but it was still the same concepts. So I really focused on, using that to highlight, my ability to learn something new and become good in that field.
Yeah, thank you for sharing that. And I think that is important. Like just a statement of saying like, yeah, I've done like back end work that like kind of like lazy the groundwork, but what actually what resulted from me doing this, or like, can you show the results? And I think that is also how people struggle. I feel like on their resumes, they don't actually like put the results or like the things that actually mattered on there, as opposed to like they maybe like little roles or responsibilities that aren't showing like actual results, which is another insight for anyone else listening to this.
Yeah, I think also too, just like being able to talk about your skills overall and not so much the tasks. I think sometimes, we struggle to show like, oh, I did something besides saying like reading off your resume and saying like what you did step by step, but like, I'm like, no, think big picture. Like that sounds more like, project management or project coordination, or like you got to use those types of words to show how they kind of are similar, even though you're doing completely different work.
Excuse me. Yes, absolutely. And then how long were you in this role? Did you have a time limit for this one when you went in?
Yeah, I did.
Yeah.
I did. Well, for that one, I was like, okay, I'll give myself 5 years here. But because there was a lot of space to move up at ICF. So ICF is all over the country for your listeners, and they have teams everywhere. They work in different sectors, but I sat in the health communication space, but they do like aviation, engineering, like they out there. So there's a lot of space to grow. So I was there 2017 to 2019, like just shy of 2 years. I didn't quite make it to 2 years, but I always say like this was one of the most fun jobs I've had. A lot of the money or the contracts we worked on were federal contracts. So if you think of like CDC, NIH, when they're doing like communication campaigns, like whether it's a commercial, whether it's a poster you might see somewhere or a sign at the airport. We did a lot of the groundwork to develop those communication campaign products. So we did a lot of focus groups to really understand what people wanted to see on a poster, for instance. So at the time I was working, Zika was a big thing. So CDC was really pushing out, wanted to do a lot of campaigns around Zika. So we, created a research project to really understand what Latinx communities wanted to see on a commercial, on a poster or something like that, and really understand the cultural issues and making sure there was appropriate representation. So then, I was able to work with like our design team to, work on our posters. So when you go on the CDC website, like we did a lot of those graphics. And I think we filmed like a couple of commercials. It was really fun because it was such a creative space, and having the backing of like the design team. So I didn't have to do the design myself, but it was kind of like understanding how the research informs the product. So I was able to kind of marry the research skills that I had before, but more in a creative environment.
Okay.
It was cool. It was a cool job.
Definitely sounds cool. And it's always cool, I feel like, when people are able to have a creativity bone in their body and they want to do creative work and also merge that with like public health or whatever that is that they're interested in. But I think there's a lot of those types of opportunities in public health, especially like translating whatever type of research into something that's easily digestible for whatever type of consumer that may be.
Yeah, I think there's still a need for those positions, and I'm sure they're still out there. I just kind of moved away from that space, but it was a lot of fun if you're a creative person and you also understand like, your messages to one group, we know that doesn't look the same for messages for another group, and really understanding your audience. So we got to do focus groups, across the country, just really understanding what people wanted to see and learn. Like there was another campaign we did for opioids, and really understanding like, so it was really about friends and family sharing their prescriptions with, someone else, not like intentionally trying to harm someone, but just, the caring aspect and really understanding that. So we went out into communities and talked to people and just, had these focus groups to understand like, okay, like what motivates you to share your prescription? And of course it comes from a space of caring, but then working to help them understand how that can have, long-term consequences, and then really working on a campaign about just not sharing, like pill sharing. So it was just really cool to be able to do that kind of work for sure.
Okay, awesome. Well, thank you for sharing that. And then after this role, you became a senior public health analyst at Aveshka Incorporated. Mm-hmm. So how do you come across that, and what do you do? And did you have a timeline for this one as well?
I did. Oh my God. So, I mean, that's just me. Like my friends know I don't stay at a job for long. And it's for different reasons. But for me, ultimately, it's like, if there's no room to grow, I'm not staying here forever. And I'm always curious about what's happening. Go ahead.
So to that point, how do you like determine how long you are looking to stay at a certain job? Is it like all those different criteria you're talking about, or like what kinds of criteria are you thinking about?
So I look for, that's a good question. Because I don't think it's like, well, for me, it is like, I do like write out like what I want in my career and what I want in a job. So, after a while, I'm like, if it's not happening, then either is something I'm doing that's not working, or this isn't a good fit for me. So, but I do look for, upward mobility. That's always, big for me in positions, as well as just making sure like it's a company fit that works for me. So even though I really liked my job at ICF, the issue with that was more so you worked, as a contractor for a lot of these federal organizations. So once your contract ended, then it was like, oh, where do you find the hours to bill? And there was issues with hours, and it was like, oh, if you don't have any hours, yeah, I was like, I need something that's more stable where I know I'm working 40 hours a week. So that was always motivation for me to find something else anyway at the time. So with this position with Aveshka, which led into my federal position, which I think subconsciously was like always the goal, because I didn't quite make it happen at the CDC position. So with this one, it was, at a federal agency, but we were contractors for that agency. And I hadn't gone into the emergency preparedness space yet. So I was always curious about, public health from that lens. So that kind of motivated me to apply and, see what happens type of thing.
Yeah, awesome. And what kind of stuff do you do in this role?
So that one is so I'm going to talk about it in the same sense as my current job, because it essentially is the same job. It's just I changed employers. But essentially, I was like, I always have such a hard time explaining this job. But the agency that I work for is called ASPR. It's called the Assistant Secretary for Preparedness and Response. So when we think public health, nobody really knows about ASPR. But if you think of like FEMA, which we know as a disaster response agency, ASPR is the public health disaster response arm of the federal government. So we respond to public health emergencies. So there's a response arm, and then there's the back end part, which is making sure the federal government is prepared for emergencies. So I help develop, strategies for how to respond to outbreaks like flu, COVID, Ebola, things like that. We have very, like strategic plans and stuff like that for how we respond. And then we also work on, or I also work on helping the government to understand how much of a product to buy. So we don't think of the federal government as like procurers, but we do buy stock. So you heard of the stockpile. So we make sure we have the right quantities of certain drugs in case something happens.
Okay, yeah. That makes a lot of sense. And so tell me about how does one go from like contractor working for the organization to then working inside the organization? What was that process like, I guess, for yourself?
Yeah, so I think for me, I guess knowing that ultimately I did want to try to go the Fed route, it was important for me to find a position, even if it was a contractor position, but that you sit in a federal space, that you weren't in your own like Aveshka building. Like Aveshka has folks who sit across HHS, whether it's CDC, ASPR, where I'm at, but you're sitting there and you're working on a federal team. So you're part of the team, you just have a different employer. So it was important for me to find a job where that was the case, where you're more embedded into the daily activities of the team. So that, in the event federal positions come out, the boss is already familiar with you, you're applying for jobs, you're letting them know you're interested, and just kind of being able to network like inside in, instead of applying just on, USA jobs and your application doesn't go anywhere. So that was kind of like the plan in the background, but also just kind of, being able to touch into a new space in public health, and that being challenging for me because I hadn't, done that across my career before. And then with this position, it's a lot more technical than I would like, but so it's a challenge for me, which I like. So I get to kind of still continue to learn and grow in the position at the time.
Okay, that makes a lot of sense. And then you also have Focus Health Collective, where you help re-examine our understanding and engagement with public health, our individual health, and the health of our communities. So when did you start this, first of all?
Yeah, I started this in 2020. I would say the pandemic kind of got me going with this. So part of it is, so with my day job, while I enjoy it, it doesn't sometimes do as much of the public health that I wanted to do. So I was, struggling with trying to find that balance, right? Of like, yeah, I'm in this field, it's interesting, response is great, but sometimes it's so technical and just so far away from, at least in my opinion, the traditional public health that I miss doing. So I wanted to find a way to still, pursue public health in a way that made sense to me, that was fun for me. And that's more like health education, just talking to people, getting into communities, which you don't get to do at the federal level, unfortunately. So sitting at home, working from home during the pandemic, I just had some time and I was like, let me just see if I can just try something on my own, because I did feel like with my 9 to 5, I was missing that enjoyment of doing work that I was more passionate about. So I was like, I'll just find a different outlet to do that. And so that's how Focus Health started. And also at the time I was like trying to find different ways to make money. I was like, oh, I need a side hustle, let me see what, this consulting thing is, and just start and see what happens. So that was kind of like the catalyst, with just like that conflict between like your career and then, what you really are passionate about.
Yeah. And I think it's important for a lot of people. They want to like quit their career and then do this other thing, but I think it's good.
Yeah, no. Some people, I'm glad you brought that up, because I think sometimes, at least I felt like, especially last year, I feel like it was a lot of that, right? With the self, awakening, and during COVID, like, I'm not meant to do this job. I'm meant to be an entrepreneur, which is great. Don't get me wrong. But for me, I'm like, no, I still need a paycheck, steady paycheck, 9 to 5. And then there's ways to pursue your passion or pursue your purpose, outside of that. So for me, I can be risk averse in that way, where I'm like, I'm not quitting my job just yet. I just got this federal position, so I'm not quitting. But I also knew like there were things that were lacking in my 9 to 5 that I wanted to still pursue.
Yeah, absolutely. And I think that that's the perfect way to do it, especially because for the majority of people, whatever they are trying to do is not going to be making as much money as a job, especially in the first couple of years. So it's important to use your job as like your investment vehicle to fund and really give you that leeway to do that kind of work that you wanted to do. So how did the thought process of this come up? Really, was it just like you wanted to have, is it the side hustle side of it, as well as like wanting to have more public health related work? Or
it was a little bit of both. I think the public health work was definitely the catalyst to do it. But also at the time, with the pandemic, I was listening to a lot of podcasts about, making money, extra money, that whole thing. And I was like, okay, how can I do both? Like, how can I, work on public health and still, make some extra money on the side and things like that. So I was kind of thinking through, what I would want that consulting business to look like. And so since I didn't have any friends who did it, I reached out to folks on LinkedIn, just, hey, I see you do public health consulting. Do you mind taking 30 minutes to just chat with me and just help me understand how you kind of, went about it? And I think what I took away from most of those conversations was just to start. You can sit and think it over and think it over and think it over and think it over, but they were just like, just start, and then you can refine your process as you go. So I just kind of, wrote up a little plan. I was like, let's just see what happens here. But the main thing was, for me, was just really getting also back in touch with just like public health and working with people and organizations and helping people understand public health. I think too, with COVID, there was a lot, beginning of the pandemic, public health was like, ooh, like people thought it was a new thing. And it was like, no, public health has been around. But I think as public health professionals, we don't always do a good job of explaining public health, just because it's probably so all encompassing, right? But I wanted to have a space where we can talk about different health issues, different things that were happening in public health, without it being like overly preachy, or too technical, where regular people wouldn't be able to understand.
Yeah, that makes a lot of sense. And then what kind of services do you offer in Focus Health Collective?
Yeah, so for better or for worse, health education and COVID has been a big thing for business. I say for better because, it really helped me get going. So I was doing a lot of presentations on, COVID and, safety measures and stuff like that. Now they're more on COVID vaccine education, but I do other like health, topics. So I've done like small groups with folks with diabetes, and we talked about, just like healthy eating, things like that, but just really more my focus is really just making sure people understand what's actually happening, right? You go to the doctor, they tell you have this, and they say, oh, go do this. And then it's like, no, how do you actually make that work for you? What does that look like? What does, your eating look like, your habits look like, and really just working with individuals to understand and how we can transform, our health and health outcomes. So that's kind of one arm where I do a lot of health education, outreach, and stuff like that. The other part, I work with organizations in developing communication plans and communication activities and how they want to reach their populations. So, making sure they understand who their audience is, how they can benefit their audiences. So I will work with them to provide guidance on how to, come out with their communication strategies and stuff like that. So kind of two things working in the background.
Okay, awesome. And did you start off with one of these services, or like what was the development of services for you?
I started off with the health communication piece because, like I said in the interview today, the ICF job, I just really enjoyed, that part of it. So that's kind of how it started. But then someone reached out to me and was like, hey, do you do COVID education? I was like, I don't, but I could. It's not on my website at the time, but I mean, I could throw together a PowerPoint. And so that started. And then I've been fortunate enough to work with really big organizations on, vaccine education for their staff, especially considering, returning to the office and whether or not they're going to have vaccine mandates and stuff. So that part of the business has picked up, but I still really enjoy doing the one-on-one health coaching with individuals as well.
Okay. And what does that health coaching look like? What are some aspects that you hit on for health coaching that you do?
Yeah, so I think about one of my clients who work on just weight management, that to help with her high blood pressure. So, I asked her if I can talk about this. She was on high blood pressure medication, and she wanted to wean herself off of that by herself. And so we talked about let's really work through the medication, understanding that, and then talking about just individual habits that we can incorporate. So we talked about, or we go through her recipes, like how she cooks, how she prepares her foods. We talk about how she can get physical activity into her day, as much as she can, and just really trying to make things more of a lifestyle and not just I just want to get to this goal, but how do we incorporate this into just your day-to-day and then your family's day-to-day. So we check in. Well, now we've kind of phased out where we check in every 6 weeks, I think it is. Before it was just every week we would check in and talk about what worked, what didn't work, and then really trying to find that sweet spot of what's effective and what's sustainable over time, as opposed to just going crazy on the diets and it's no, that's not going to work for you. So that's been really fun working with her at first, and then getting her family involved. Her husband and her kids are involved and stuff like that. So that's been one of the highlights for me, is working with her.
Okay, yeah, and that's awesome. And I think it is important that you highlight you have to get the husband and family involved, because it is it's a lifestyle thing, and big part of our lives, our families, and how we interact with them, and how that interacts with our health and lifestyle and what we do around that. So there's a lot of different dynamics, and it's hard especially when you're living in a system that doesn't make healthy choices and easy choices, or just makes it hard to access different things, and then we get these unhealthy norms, I should say. And yeah, it's a lot, especially when people are just used to doing the same things constantly. But yeah, kudos to you for doing that work. We appreciate you as well.
Oh, thanks.
Yeah. And what have you learned from this entire business venture and everything going forward? And before you answer, I also wanted to highlight that you said that you reached out to other public health entrepreneurs or entrepreneurs on LinkedIn to get their insights. And I think that is hugely important. Don't try to start something without getting some information from other people that are doing it, to see how they can help you, or just get you to where you want to be just a little bit quicker. Maybe that little piece of advice is going to be very beneficial. But yeah, sorry, what are some learnings that you've gone from this?
I think the biggest thing is just to start. I think sometimes, we think we need to have, this super long, in-depth plan, but we can get stuck in the planning and never move to doing. So for me, that was part of my challenge, was to just start. And I know, like, with time, I can always refine, what I'm working on. So that was just a matter of like, okay, come up with the name, come up with a website, like just actually doing things, reaching out to folks, like cold pitching, my business to organizations to see if somebody needed help. So I think that was like the main thing for me. Like I said, I'm usually more risk averse. I really like to stay safe and just, really have my things planned out. But with this one, it was kind of like, just try and see what happens. It's just go for it. And if it flopped, I'm like, it's still better than most people who didn't do it. So that was my attitude.
Good. And yeah, like, even if it flops, you're back in the same place that you were in the beginning. So
exactly.
At least you're not going to say that you regret not trying it and you did it, right? So
right. Exactly.
Yeah. Okay. So before I move you on to the last section of the show, the Furious Five, I wanted to ask, where do you want to see yourself in the future?
That's a good question. I know you had it on there. That's been like a question on my mind the last couple of months, as I'm trying to apply for these DrPH programs, because they ask, oh, what do you see yourself doing? But for me, career-wise, I really enjoyed this this emergency preparedness and response space. What I would want to see for myself is being able to marry public health into the way we do responses as a federal government, which I haven't quite figured out how that's going to look like, but I think there are still ways that we can really focus on having, for instance, like targeted, health communication for different groups of people. I think as in the federal space, we don't always do a good job. We kind of do a one size fits all, here's your COVID message of the day type of thing, but really understanding like different communities and making sure we're getting community buy-in into programming and campaigns, and making sure communities are really ready to respond. Like, why is it that, certain populations will evacuate versus other populations won't evacuate when there's a hurricane coming? But really getting to the roots of some of those issues and concerns, whether it's around, funding and things like that. But for me, I think my wish list would be to be able to be in a space where public health interventions are actually happening when we think about response and how we organize and plan for emergencies. Like, we can't just do the one size fits all thing as we've been seeing with COVID, right? Like, the one big response it's not doing its job. So not sure if I answered it just yet, but that's kind of the idea, is to really get into more public health focus in the way we do response, if that makes sense.
Yeah. Absolutely. It does make sense. Thank you for sharing that. And I was going to move you on to the Furious Five, but you mentioned applying for the DrPH program. So tell me about like why you're thinking, or like what is the aim of applying and trying to get your DrPH?
Yeah, so probably not the best reason, but I also am like, what else can I do with myself, right? I love a good challenge, so I know I didn't want to do the PhD. I knew that my research days, I think, are behind me in terms of like that traditional research and things like that. Well, I think it's great. I think my focus is more on implementation and how we actually put those public health research findings into action. So I just felt the DrPH was a better fit for me. And also just considering like how long I've been out of school and that whole thing. So I've been applying. Well, applications they've been due. They were due December 1st. So that's done. So we'll see, how that goes. But yeah, that was something that's always kind of been in the back of my mind. Like, one day I might go back. One day I think about it, and I was like, why not? Like, what else do I have going on? So just add one more thing to my plate. So
Okay. Well, I hope good luck on the application. I guess it's done now. Good luck on the process, and hopefully you get in. And we love to see your progression on that moving forward. Yeah, you're most welcome. You're most welcome. So
Appreciate that.
Yeah, of course. And then moving on to the last section of the show, the Furious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say to take that chance, whether it's an internship, a job, to take the one that you may not be the most excited about. Because oftentimes you end up getting the most experience, or there's still something to learn from that. I think when we go into school, we think our careers are going to have this like straight line trajectory, but the reality is it's going to be up and down. And you have to be able to take something and take nothing and make it into something, if that makes sense. So that's what I would tell someone is to, take that internship, take that fellowship, just to learn and get that experience that you are definitely going to need these days.
Okay. Yeah. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Okay. I would say network. And it's so funny that I'm giving that because I hate the word network as an introvert. Like it is not, I don't want to do it. But I think networking doesn't have to look like how you think it is. Networking is just, I think, building relationships with people, and that's how I look at it. I don't see it as like forcing a coffee date. It's just, meeting people, making connections, and then staying in touch with people. I think that's just important to do. And that's how I've been able to use those connections to kind of leverage, the opportunity that I have now.
Okay. Yeah, great advice. Number three, what's something you are working on improving in your life right now?
So I have been working on time management and not overcommitting myself. So that's something that I continue to work on. I like to say yes to things, and I've been learning that sometimes I have to just say no. Like that's been my lesson the last quarter of this year. Like when my gut tells me don't do it, just don't do it.
Yeah,
working on it.
Yeah, absolutely fair enough. Number four, professionally, do you recommend anything?
At least that's not how I interpreted it. So because I didn't go with like a professional, I went with like a life.
Yeah, that's fine. People share different things. Cool, so cool. You are all good.
Okay. So I've been, doing the podcast thing or listening to podcasts. So I would recommend a podcast called Journey to Launch by Jamila Souffrant. And it's all about finances. And as a Black woman, she really talks about getting your finances in order, how important that is for us, not just as women, but just as people in general, to understand your money and where your money goes and your plans for your money. So she's been, getting me through the day. She has hundreds and hundreds of episodes, and she brings on folks who have been able to, eliminate their student loan debt, all that stuff. And I'm like, oh my God. So it's been really great to hear from her and her guests on, the fact that one, you can pay Uncle Sam off at some point. So it's just been very motivational for me to hear that. So she's great. She was just on Good Morning America. I'm over here plugging her like I know her, but her podcast is pretty dope.
Yeah. Okay, thank you. And I'll be sure to link that in the show notes as well. And then last but not least, where can people connect with you?
You can connect with me on LinkedIn and Instagram. So those are where I'm most active. I do have a Facebook account, but that thing is just dusty. But LinkedIn, Rose A. Marcelin MPH, I think is how I have it. And then on my Instagram at Focused Health Collective. Those are the main ways to get in touch with me. I love connecting with people on social on LinkedIn. I talk to students all the time on LinkedIn, set up phone calls and interviews with them. So that's always fun. And then on LinkedIn or Instagram, I get to connect with other folks in public health who are doing, really cool work.
Awesome. And I'll be sure to link those in the show notes as well as the description of the show for anyone that would like to connect with you. But thank you so much for coming on and taking time and sharing your story and your insights. I greatly appreciate it. I know others are going to greatly appreciate it as well.
Awesome. Thank you for having me. I've been a fan. So I'm happy to have made it to the hot seat.
we are most happy. Well, I'm very happy to have you. So housekeeping items for everyone else. Thank you so much for watching or listening to this. Make sure that you subscribe if you haven't subscribed as yet, or follow if you're on Apple Podcast. Make sure to leave a like if you're watching on YouTube. Leave a review everywhere that you can review and share with a friend. I greatly appreciate that. And if you'd like to support, you can go to buymeacoffee.com/theph Millennial or thephmillennial.com/support, and you can find all the different ways to support there. But thank you all so much, and see you all next week.